Good afternoon, everyone. A very warm welcome to you all. You're watching the second series of the live phone-in program organized by the Tele-Center for Persons with Communication Disorders, All India Institute of Speech and Hearing, MYSURU. I'm Dr. Priya MB. I'm an assistant professor at the Department of Speech Language Pathology and a member of the Learning Disability Clinic at AIISH, MYSURU. I'll be the moderator for today's session. The All India Institute of Speech and Hearing, popularly known as AIISH MYSURU, needs no formal introduction. Yet, for the benefit of our viewers and listeners, I would like to mention that AIISH is a premier institute and a pioneer in the field of speech and hearing under the Ministry of Family and Health and Family Welfare, Government of India. The month of October, AIISH is commemorating as the Learning Disability Awareness Month. Research report states that learning disability is found to be in children to about 5 to 10%, especially in the school-going children. In India, the prevalence rates of learning disability ranges from 3 to 10%. So today's program will focus on building awareness about the characteristics, the signs and symptoms, the identification, assessment, and the management process in children with learning disabilities. So we are privileged to have the resource persons for today's program who are working in the area of learning disability. So let me introduce the resource persons for today's program. On my right is Dr. Jayashree C. Shanbal, who is an associate professor and the chairperson of the Learning Disability Clinic at AIISH MYSURU. She is also the head of the Tele-Center for Persons with Communication Disorders, AIISH. She has an extensive clinical as well as research experience in the area of learning disability. A very warm welcome to you, ma'am.
Thank you so much.
We also have with us Dr. Yashoda Kumar. Dr. Yashoda is a clinical psychologist at the Department of Clinical Psychology, AIISH MYSURU. He also has a wide range of experience in the assessment and management of individuals with learning disabilities. Welcome to you too, sir.
Thank you.
On my extreme right is Mrs. Shobha BM, who is our third resource person. She is a special educator by profession and is working at the Department of Special Education at AIISH MYSURU. Madam also has several years of experience in the assessment and management of academic issues in children with learning disabilities. A warm welcome to you too, ma'am.
Thank you.
Please remember, this is a live program and our resource persons will be here with us to answer all your queries. You can reach us by dialing the number displayed on the screen, which is 0821 250 2530. I repeat, 0821 250 2530. Please remember that this discussion is also being streamed live on Facebook. You can also post your questions on the comment section over there. So let's get this program started. My first question is to Dr. Jayashree C. Shanbal. Ma'am, can you please explain to our audience as to what is a learning disability? How do a common man understand about learning disability?
First of all, a very good afternoon to all of you. Yes, I think this subject that we are talking today on learning disability is something very apt. As Dr. Priya MB already mentioned, there's a high prevalence of learning disability in schools. So what is learning disability? So when somebody has to understand what learning disability is, I think we should understand probably how we are going to look out for certain signs and how these signs have to be looked out by professionals. So let us just go one by one. Generally, if you see children with learning disability, these children look like they're very normal. So learning disability is considered a hidden disability because the signs are not seen overtly. The other most important signs that we have to look out for is that these children will have average or above average IQ, which means intelligence quotient. You will see that these children kind of have normal intelligence. That's what I mean to say, normal or better intelligence. Sometimes you will see that these children do not have obvious sensory issues. So, sensory impairments, I would say. For example, visual impairment, it's possible that they can have, it's not that because of a visual impairment that they are having problem, but it is something above that. These may not have hearing impairment. That means when you talk about decibels, when they're supposed to hear certain information and when we test them for hearing, these children come out to be normal. The motor development is yet another factor. You see that these children have adequate motor development, which means they walk and they sit and they crawl. All of these are happening just like the normal children. So, in spite of all of these things, you will see that these children, in spite of all of these things being normal, you will see that these children are having problems with academics in school, which means they have reading and writing problems. So, very simply put, in spite of having intelligence fine, in spite of having no sensory impairment, in spite of having motor development fine, no inadequacy in terms of environment, no emotional problems, all of these are normal, but still the child can have reading, writing issues. So, these children generally come under the category of learning disability technical. Now, let me just differentiate what is learning disability and learning difficulties. So, you might see that a lot of them are trying to differentiate, or sometimes they think they're the same thing. It's not so. Learning disability, I already told you, technically it just means that everything else in terms of intelligence, motor, sensory, everything seems fine, but still they have reading, writing problems. Whereas in learning difficulties, generally you see that these children usually have IQ issues, which means intelligence is not according to their age. Okay, so those are the children. For example, children with intellectual disabilities can have learning problems, obviously. So these are called as learning difficulties. And sometimes you might see that children have hearing impairment. That means they can't hear at all. And you might have seen them using a hearing aid. So because of their hearing impairment, they are not able to read and write properly. That's called as learning difficulties. There can be another group of children called cerebral palsy who are having physical motor problems, weaknesses or stiff muscles. It's possible that because of this they have reading and writing problems. Then you call them as learning difficulties. A lot of times vision problems, we have a lot of children coming to us initially saying that they cannot copy from the board properly. So the first thing that we do is we send them to an ophthalmologist and get the testing done for their eyes. And then we realize actually it is because of their vision problems that they were having problems in reading and writing. If this was rectified, the children were doing very well in school. So this is yet another problem with learning difficulties. So you have to differentiate what is a disability versus difficulty.
Thank you, ma'am. I think that's a very important aspect as well, because most of the clients or viewers might have this confusion as to what a learning difficulty is and what a disability actually means. So, with that understanding, I think it becomes also important to understand the causes of learning disability. What actually causes this? So, if I may add, it is mainly one of the hereditary conditions, or it could be genetic. That is, it's common to see parents of children who have learning disabilities to also have had struggles in their early life with the same kind of problems. So, neurobiological factors could be another potential reason. That is, the brain of these children could be functioning very differently, which affect different cognitive processes important for the purpose of learning. Dr. Yashoda, my next question is to you. Does lack of parental involvement also cause learning disability? Does it have any influence?
Okay, yeah. I can say in a way yes and no, even both. The reason is, for example, if parents are neglected, child's academic, progress, or child's academic learning in the early age or the initial age. So what happens is, if for example child for some reason, some health issues and all, child frequently takes leave, or child gets an accident and all to the school. Obviously child gets a gap in the academic or curriculum. So, and our curriculum is like connected to one, and the lower class and curriculum and a child needed for the higher or the next level smooth and progress. So in that case, child definitely face an issue here, being that a child, since a child due to this accident or due to these health issues, child could not cope up with the actual curriculum what teacher taught in the class. So obviously that may show some of the difficulty in some part of the children. But let me tell you, if we correct at that age, so definitely if child is not LD or child is not with learning disability, child can correct and child can progress smoothly with the academics. So there will be no, and a child will not be having any issues further. If child ignores or child not corrected in that point, and the gap remains same, and that gap may lead to the more difficulty in the child's academic performance in the higher classes. So that may go to the difficulty level.
Sorry to interrupt you, sir. Let's take this call first. Hello. Hello.
Hello.
Yes, madam. We can hear you.
Yes, ma'am, I can hear.
Please ask your query.
ಮ್ಯಾಮ್ ಕನ್ನಡದಲ್ಲಿ ಕೇಳ್ಬೋದು ಕ್ವಶನ್?
ಖಂಡಿತ ಕೇಳಿ. ನಿಮ್ಮ ಹೆಸರು ಹೇಳಿ ಮೇಡಮ್.
ಮ್ಯಾಮ್ ನಂದಿನಿ ಅಂತ.
ಹೇಳಿ.
ನಾವು ಆಲ್ರೆಡಿ ತನುಶ್ರೀ ಅನ್ನೋ ಪೇಷಂಟ್ ನ ಕನ್ಸಲ್ಟ್ ಮಾಡಿದ್ವಿ ಡಾಕ್ಟರ್ ಹತ್ರ, ಇಲ್ಲಿ ಐಶಲ್ಲೇ.
ಓಕೆ.
ಡಾಕ್ಟರ್ ಯಶೋಧ ಕುಮಾರ್ ಅಂತ ಅವ್ರ ನೇಮು.
ಅವರು ಇಲ್ಲೇ ಇದ್ದಾರೆ, ಹೇಳಿ.
ಸರಿ ಮ್ಯಾಮ್, ಅವ್ರು ಅದೇ ಅವ್ರ ಕನ್ಸಲ್ಟ್ ಮಾಡಿ ಒಂದು 2 weeks ತೋರಿಸಿದ್ವಿ ಅವ್ರ ಹತ್ರ.
ಓಕೆ.
ಅದೇ ಒಂದು ಇನ್ನೂ ಏನ್ ಅಂತ ಚೇಂಜಸ್ ಏನ್ ಕಾಣಲಿಲ್ಲ ಮ್ಯಾಮ್. ಅಂದ್ರೆ ಬರೀತಾನೆ ಎಲ್ಲ, ಬಟ್ ನಾವ್ ಹೇಳ್ಕೊಟ್ಟಿದ್ದನ್ನು ಚಂದ ನೆನ್ಪಿಟ್ಕೊಳ್ಳಲ್ಲ ಅವಳು.
ಆಯ್ತು.
ಮತ್ತೆ ಸ್ವಲ್ಪ ಗ್ರಾಸ್ಪಿಂಗ್ ಪವರ್ ಕಡಿಮೆ ಇದೆ ಅವಳಿಗೆ.
ಓಕೆ.
ಬಟ್ ಬರೆಯೋದೇನಿದೆ ನೋಡ್ಕೊಂಡು ಬರೀತಾಳೆ ಅಷ್ಟೇ. ಬಟ್ ಡಿಕ್ಟೇಟ್ ಮಾಡೋದ್ರಲ್ಲಿ ಅವ್ರಿಗೆ ಸ್ಪೆಲ್ಲಿಂಗ್ಸ್ ಎಲ್ಲ ಮಿಸ್ಟೇಕ್ಸ್ ಮಾಡೋದು, ಆಮೇಲೆ ಇವಾಗ ಹೇಳ್ಕೊಟ್ಟಿರ್ತೀವಿ ನೆಕ್ಸ್ಟ್ ಟೈಮ್ಗೆ ಮರ್ತೋಗ್ಬಿಟ್ಟಿರ್ತಾಳೆ ಅದನ್ನ. ಆ ತರ ಇದೆ ಮ್ಯಾಮ್. ಅದಕ್ಕೇನಾದ್ರು ಇದೆಯಾ ಅಂತ ಕೇಳೋಣ ಅಂತ ಫೋನ್ ಮಾಡಿದ್ವಿ ಮ್ಯಾಮ್.
ಓಕೆ. I would like to ask Dr. Yashoda to take up this question.
ನಮಸ್ಕಾರ ಅಮ್ಮ. ತನುಶ್ರೀ ಅಂತ ಹೇಳಿದ್ರಿ ಅಲ್ವಾ?
ಸರ್.
ಇದು ಯಾವ ಕ್ಲಾಸ್ ಈಗ?
ಅವ್ಳು ಇವಾಗ 8th standard ಸರ್.
ನಿಮ್ಗೆ ಗೊತ್ತಿರ್ಬೋದು, ನಾವು ಆಗಲೇ ಹೇಳಿರ್ತೀವಿ. ನಾನಷ್ಟೇ ಅಲ್ಲ, ಬೇರೆ ನಮ್ಮ ಸಂಸ್ಥೆಯಲ್ಲಿ ಇರುವಂಥ ಬೇರೆ ಪ್ರೊಫೆಷನಲ್ಸ್ ಎಲ್ಲರೂ ಹೇಳಿರ್ತಾರೆ. ಇದು ಡಿಸೆಬಿಲಿಟಿ ಅಂತ ಇದ್ದಾಗ ಏನಾಗುತ್ತೆ, ಅದ್ರ ಜೊತೆಗೆ ಹೋಗೋದನ್ನ ಕಲಿಬೇಕಾಗತ್ತೆ. ಸೊ ಅಂದರೆ ನೀವು ಕೂಡ ಮಗುನ ಅಕ್ಸೆಪ್ಟ್ ಮಾಡ್ಕೋಬೇಕು, ಈ ಮಗು ಈ ಥರ ತೊಂದರೆ ಇದೆ ಅಂತ. ಹಾಗಂತೇಳಿ ಆ ಮಗು ಎಲ್ಲ ವಿಷಯದಲ್ಲೂ ಅಥವಾ ಎಲ್ಲ ಫೀಲ್ಡಲ್ಲೂ ಕೂಡ ತೊಂದರೆ ಇದೆ ಅಂತ ಅಲ್ಲ. ಈಗ ನನ್ನ ಪ್ರಕಾರ ಆ ಮಗುಗೆ ನೀವು ಸರಿಯಾಗಿ ವಾಲಿಬಾಲು ಅಥವಾ ಇನ್ನೊಂದೇನೋ ಒಂದು ಸ್ಪೋರ್ಟ್ಸ್ ಬಿಟ್ಟರೆ ಆ ಮಗು ಅದರಲ್ಲೇ ಚೆನ್ನಾಗಿ ಬರ್ಬೋದು. ಸೊ ಅದನ್ನ ನೀವು ನೋಡ್ತಿರಲ್ಲ, ಯಾಕೆಂದರೆ ನೀವು ಅದು ನಮ್ಮ ಸಮಾಜನೂ ಕೂಡ ಹಾಗೇನೆ ಬರೀ ಅಕಾಡೆಮಿಕ್ ಅಥವಾ ಬರೀ ಓದೋದು ಅನ್ನೋದನ್ನೇ ನಾವು ಹೆಚ್ಚಿಗೆ ಫೋಕಸ್ ಮಾಡ್ತಿರ್ತೀವಿ. ಸೊ ಮೇ ಬಿ ಆ ಮಗುಗೆ ಇನ್ನೊಂದು ಫೀಲ್ಡಲ್ಲಿ ಸಾಮರ್ಥ್ಯ ಇರಬಹುದು. ದಯವಿಟ್ಟು ಅದನ್ನು ನೋಡಿ. ನೀವು ಹೇಳ್ತಿರೋದು ಬೇಗ ಮರ್ತೋಗ್ತಾಳೆ, ನೆನ್ಪಿಟ್ಕೊಳ್ಳಲ್ಲ, ಬೇಗ ಕ್ಯಾಚ್ ಮಾಡಲ್ಲ ಹೇಳ್ಕೊಟ್ಟಿದ್ದನ್ನ. ಸೊ ಇದೆಲ್ಲ ಪಾರ್ಟ್ ಆಫ್ ಮಗುವಿನ ತೊಂದರೆ, ಇದು ಡಿಸೆಬಿಲಿಟಿ ಏನಿದೆ ಆ ಒಂದು ಭಾಗ ಅಷ್ಟೇ. ಅದನ್ನು ದಯವಿಟ್ಟು ಅರ್ಥ ಮಾಡ್ಕೊಳ್ಳಿ. ತುಂಬ ಪ್ರೆಷರ್ ಹಾಕಿ ಇದು ಮಾಡೋದು ಬದಲು ಆ ಮಗುವಿನ ಬೇರೆ ಸಾಮರ್ಥ್ಯ ಅಥವಾ ಸ್ಟ್ರೆಂತ್ ಏನಿರುತ್ತೆ ಅದ್ರ ಕಡೆಗೆ ನೀವು ಫೋಕಸ್ ಮಾಡಿದ್ರೆ ಒಳ್ಳೆಯದು ನನ್ನ ಪ್ರಕಾರ. ಸೊ ಜೊತೆಗೆ ಒಂದು 10th ಆ್ಯಂಡ್ ನಿಮಗೆ ಗೊತ್ತು 10th ಬಂದಾಗ ಮಗುಗೆ ಎಜುಕೇಷನ್ ಕನ್ಸೆಷನ್ಸ್ ಎಲ್ಲ ಸಿಗುತ್ತೆ. ಶಾಲೆಯಲ್ಲಿ ಒಂದು ಸಬ್ಜೆಕ್ಟ್ ಬೇಡ ಅಂದರೆ ಅದು ರಿಲ್ಯಾಕ್ಸೇಷನ್ ಸಿಗುತ್ತೆ, ಹಾಗೆ ಎಕ್ಸ್ಟ್ರಾ ಟೈಮ್ ಸಿಗುತ್ತೆ. ಈ ಥರದ್ರಲ್ಲಿ ಒಂದು ಬೇಸಿಕ್ ಲೆವೆಲ್ವರೆಗೂ ಎಜುಕೇಷನ್ ಕೂಡ ಖಂಡಿತ ಮಾಡ್ಬೋದು. ಅದಕ್ಕೆ ನೀವು ಚಿಂತೆ ಮಾಡೋ ಅಗತ್ಯ ಇಲ್ಲ, ಆಯಿತಾ? ಸೊ ಹಾಗಾಗಿ ಈ ಸಾಮರ್ಥ್ಯ ಏನಿದೆ ಅದ್ರ ಕಡೆಗೆ ಫೋಕಸ್ ಮಾಡಿದ್ರೆ ಒಳ್ಳೆಯದು.
ಡಾಕ್ಟರ್ ಜಯಶ್ರೀ ಅವರೇ, ನೀವು ಅವ್ರಿಗೇನಾದರೂ ಹೇಳೋದಕ್ಕೆ ಇಷ್ಟಪಡ್ತೀರಾ?
ನೀವು ಎಷ್ಟು ವಯಸ್ಸು ಅಂತಂದ್ರೆ ನಿಮ್ಮ ಮಗಳಿಗೆ?
ಇವಾಗ 8th standard ಮ್ಯಾಮ್, 13 years.
ಹೌದು. ಸೊ ಇದರಲ್ಲಿ ನಾನು ಇನ್ನೊಂದು ವಿಷಯ ಹೇಳಕ್ಕೆ ಇಷ್ಟಪಡ್ತೀನಿ. ಏನೇ ಲರ್ನಿಂಗ್ ಆಗುವಾಗ ಒಂದು ಕ್ರಿಟಿಕಲ್ ಪೀರಿಯಡ್ ಆಫ್ ಲರ್ನಿಂಗ್ ಅಂತ ಇರುತ್ತೆ. ಸೊ ಆ ಕ್ರಿಟಿಕಲ್ ಪೀರಿಯಡ್ ಆಫ್ ಲರ್ನಿಂಗ್ ಅಂದರೆ ಮಿದುಳು ಆ ಟೈಮಲ್ಲಿ ತುಂಬ ಫ್ಲೆಕ್ಸಿಬಲ್ ಆಗಿರುತ್ತೆ. ಅಂದರೆ ನೀವೇನು ಹೊಸದಾಗಿ ಹೇಳ್ಕೊಟ್ರು ಅದು ಅದನ್ನು ಆಕ್ಸೆಪ್ಟ್ ಮಾಡಿ ಕಲ್ತ್ಕೊಂಡು ಆರ್ಗನೈಸ್ ಮಾಡ್ತಾ ಇರುತ್ತೆ. ಈಗ ಕೆಲವು ಮಕ್ಕಳನ್ನ ನಾವು ತುಂಬ ಲೇಟಾಗಿ ಐಡೆಂಟಿಫೈ ಮಾಡಿ ಮಿದುಳು ಬೆಳವಣಿಗೆ ಆಗೋಗಿರುತ್ತೆ. ಅದಾದ ಮೇಲೆ ನಾವು ಆ ಮಗುವಿಗೆ ನಾವೇನೋ ಟ್ರೈನಿಂಗ್ ಮಾಡಬೇಕು ಅನ್ನೋದೆಲ್ಲ ನಾವು ನೋಡ್ತಾ ಹೋದರೆ ಆ ಥೆರಪಿದು ಒಂದು ಪರಿಣಾಮ ಏನಿರುತ್ತೆ ಅದು ಹೆಚ್ಚು ಇರೋದಿಲ್ಲ ಅಲ್ಲಿ. ಹಾಗಾಗಿ ಯಶೋಧರವ್ರು ನಿಮ್ಗೆ ಹೇಳ್ತಾ ಇದ್ದಿದ್ದು, ಈ ಮಗುಗೆ ನೀವು ಓದೋದ್ರ ಬಗ್ಗೆನೇ ಹೆಚ್ಚು ಒಂದು ಸ್ಟ್ರೆಸ್ ಕೊಡ್ತಾ ಇರಬೇಡಿ, ಬೇರೆನೂ ಆಲ್ಟರ್ನೇಟಿವ್ಸ್ ನೋಡ್ತಾ ಇರಿ. ಆದರೆ ಈಗ ಪ್ರಾಕ್ಟಿಕಲ್ ಸಿಚುವೇಶನ್ ನೋಡೋಕ್ಕೆ ಹೋದರೆ ಒಂದು ಬೇಸಿಕ್ ಎಜುಕೇಷನ್ ಆಗಿಬಿಡ್ಲಿ ಅಂತ ಎಲ್ಲರೂ ಅನ್ಕೋತೀವಿ. ಸೊ ಹಂಗಿರುವಾಗ ಈ ಥರ ಮಕ್ಕಳಿಗೆ ಬೇರೆ ಓಪನ್ ಸ್ಕೂಲ್ ಸಿಸ್ಟಮ್ ಆಪ್ಷನ್ಸ್ ಎಲ್ಲ ಇದೆ, ಆಯಿತಾ? ಸೊ ಅದನ್ನು ನೀವು ಮುಂದಕ್ಕೆ ಅದನ್ನು ಪ್ರಯತ್ನ ಪಡ್ಬೋದು. ಮತ್ತು ಸ್ಪೆಷಲ್ ಎಜುಕೇಟರ್ಸಿಂದ ಕರಿಕ್ಯುಲರ್ ಸಪೋರ್ಟ್ ಸರ್ವಿಸಸ್ ಅಂತ ನಾವು ತೊಗೊಳ್ಬೋದು. ಅಲ್ಲಿ ನಿಮಗೆ ಕೆಲವು ಸ್ಟ್ರಾಟಜೀಸ್ ಎಲ್ಲ ಹೇಳ್ಕೊಡ್ತಾರೆ. ಇಂಥ ಮಕ್ಕಳು ಯಾವ ರೀತಿ ಓದಬೇಕು, ಯಾವ ರೀತಿ ಕಲಿಬೇಕು ಅನ್ನೋದನ್ನೆಲ್ಲ ಆ ಸ್ಟ್ರಾಟಜೀಸ್ ಎಲ್ಲ ಅವ್ರು ನಿಮಗೆ ಫಾಲೋ ಮಾಡೋಕ್ಕೆ ಹೇಳ್ತಾರೆ, ಆಯಿತಾ? ಸೊ ನಾನು ನಿಮಗೆ ಡಿಮೋಟಿವೇಟ್ ಮಾಡ್ತಾ ಇಲ್ಲ, ಬಟ್ ಹೇಳ್ತಾ ಇರೋದೇನೆಂದರೆ ಈ ಸ್ಟೇಜಲ್ಲಿ ಈ ಮಗುಗೆ ನೀವು ಏನು ಮಾಡಬೇಕು ಮುಂದಕ್ಕೆ ಅನ್ನೋದನ್ನು ಯೋಚನೆ ಮಾಡಬೇಕು, ಆಯಿತಾ? ಸೊ ನೀವು ಹೇಳ್ತಾ ಇದ್ರಿ 2 ವಾರ ಬಂದಿದ್ರಿ ನೀವು, ಏನು ತುಂಬ ಚೇಂಜಸ್ ಕಾಣಿಸ್ಲಿಲ್ಲ ಅಂತ. ಸೊ ಈ ಮಗು ಪ್ರಾಬಬ್ಲಿ ಹುಟ್ಟಿನಿಂದಲೇ ಇರೋವಂಥ ತೊಂದರೆ ಇರ್ಬೋದು ಇದು. ಈಗ 2 ವಾರದಲ್ಲಿ ಒಂದು ದೊಡ್ಡ ಚೇಂಜ್ ಬಂದ್ಬಿಡುತ್ತೆ ಅಂತ ನಾವು ಎಕ್ಸ್ಪೆಕ್ಟ್ ಮಾಡೋಕ್ಕಾಗೋದಿಲ್ಲ. ಅದಕ್ಕೆ ಸ್ವಲ್ಪ ಸಮಯ ಆಗುತ್ತೆ, ಯಾಕಂದರೆ ಅದು ಟ್ರೈನ್ ಆಗಬೇಕಲ್ಲ ಮಗು. ಸೊ ಹಾಗಾಗಿ ಟ್ರೈನಿಂಗ್ ಸ್ವಲ್ಪ ಮಟ್ಟಿಗೆ ನಾವು ವರ್ಕ್ ಟ್ರೈನ್ ಮಾಡ್ಬೋದು. ಆದರೆ ತುಂಬ ಈಗ ಪ್ರಾಬಬ್ಲಿ ನೀವು ಆ ಮಗುನ 6 ವರ್ಷದ ವಯಸ್ಸಿಗೆ ಅಥವಾ 7 ವರ್ಷದ ವಯಸ್ಸಿಗೆ ನೀವೇನಾದ್ರು ಕರ್ಕೊಂಡು ಬಂದಿದ್ದರೆ ಆವಾಗ ನಾವು ಕೊಟ್ಟಿರೋವಂಥ ತರಬೇತಿ ಎಷ್ಟು ಇಫೆಕ್ಟಿವ್ ಆಗಿರ್ತಾ ಇತ್ತೋ ಅದು ಈ ವಯಸ್ಸಿಗೆ ಇರೋದಿಲ್ಲ, ಆಯಿತಾ? ಹೆಚ್ಚು ಇಫೆಕ್ಟಿವ್ ಆಗಿರೋದಿಲ್ಲ. ಹಾಗಾಗಿ ನೀವು ಬೇರೆ ಸೊಲ್ಯೂಷನ್ಸ್ನ ಹುಡ್ಕೋಬೋದು. ಅದಕ್ಕೆ ನಾನು ಹೇಳ್ತಾ ಇದ್ದೆ, ನೀವು ನಮ್ಮ ಸಂಸ್ಥೆಗೆ ಬಂದರೆ ನಮ್ಮ ಸ್ಪೆಷಲ್ ಎಜುಕೇಷನ್ ಡಿಪಾರ್ಟ್ಮೆಂಟು ಇದೆ, ಅಲ್ಲಿ ಕರಿಕ್ಯುಲರ್ ಸಪೋರ್ಟ್ ಸರ್ವಿಸಸ್ ಅಂತಿದೆ, ಅಲ್ಲಿ ನೀವು ಸಪೋರ್ಟ್ ತೊಗೋಬೋದು. ಅಲ್ಲಿ ನಿಮಗೆ ಓಪನ್ ಸ್ಕೂಲ್ ಸಿಸ್ಟಮ್ ಬಗ್ಗೆ ಕೂಡ ಹೇಳ್ತಾರೆ, ಆಯಿತಾ? ಸೊ ಆ ಮಾಹಿತಿನ ನೀವು ಇಲ್ಲಿ ಬಂದು ಕಲೆಕ್ಟ್ ಮಾಡ್ಕೊಳ್ಳೋದು ಒಳ್ಳೆಯದು, ಸರಿನಾ?
ಓಕೆ, ಥ್ಯಾಂಕ್ ಯು ನಂದಿನಿ ಅವರೇ. ನಿಮ್ಮ ಪ್ರಶ್ನೆಗೆ ಉತ್ತರ ಸಿಕ್ಕಿದೆ ಅಂತ ಭಾವಿಸ್ತೀನಿ. ಥ್ಯಾಂಕ್ ಯು. My next question will be to Mrs. Shobha. Ma'am, can you please tell us as to what are the problems that are associated in the school participation of children with learning disability?
Children with learning disability, as all of us know, they have a problem in reading, writing and arithmetic. Apart from this, as these children have memory issues and problem in retention, they find it difficult to focus on a verbal instruction given by the teacher. And due to their orientation problem, it is difficult for them to copy from the blackboard as well. And these children, as they have a less concentration and attention, they do not remember the verbal instructions, and it is difficult for them to do the homework given by the class teacher or the subject teacher. And not only in academic performance, sometimes these children find it difficult to involve themselves in a co-curricular activities also, because they're not able to follow the rules and regulations of the games sometimes. So all these problems like attending the verbal instructions and orientation problems, a lack of memory problem, so all these leads to less performance in the classroom.
Okay, thank you, ma'am. Dr. Jayashree, can you please tell us as to what kind of professional should be seen if a learning disability is suspected? Can we answer the call first? Hello? Hello?
ಹಲೋ ಮೇಡಮ್, ನಾನು ಸಮರ್ಥ ಅವ್ರ ಪೇರೆಂಟ್ಸ್.
ಹೇಳಿಮ್ಮ, ತಮ್ಮ ಹೆಸರು ಹೇಳಿಮ್ಮ ಮೊದಲು.
ಟೀಚಿಂಗ್ ಕರ್ಕೊಂಡ್ಬರ್ತಾ ಇದ್ದ, ಅವನು ಬರೀತಾನೆ ಮೇಡಮ್, ಓದಲ್ಲ.
ಬರೀತಾನೆ ಓದಲ್ಲ. ಓಕೆ,
ಹೇಳಿದ್ಕೆ ಅವ್ನಿಗೆ ಗೊತ್ತಿರೋದು ಗುರ್ತಿಸಿದ್ರು ಅಂತ ಆದ್ರೆ ಬರೀತಾನೆ.
ಆಯ್ತು.
ನೀವು ಹೇಳಿದ್ರೆ ಡಿಕ್ಲೇಷನ್ ಬರೀತಾನೆ. ಅದ ಏನು ನಾನು ಏನ್ ಬರ್ದೆ ಏನ್ ಬಿಟ್ಟೆ ಅವ್ನಿಗೆ ಏನು ಅರ್ಥ ಆಗಲ್ಲ. ಅವ್ನಿಗೆ ಒಂದು ಕನ್ನಡ ಬುಕ್ ಕೊಡಿ, ಓದಲ್ಲ. ಅದನ್ನೇ ಈಗ ಬರೆಯಪ್ಪ ಇಷ್ಟೊಂದು ಬರೀತಾನೆ.
ಯಾವ ಕ್ಲಾಸಲ್ಲಿ ಓದ್ತಾ ಇರೋದು ಸಮರ್ಥ?
ಸಮರ್ಥ 7ನೇ ಕ್ಲಾಸ್ ಮೇಡಮ್.
7ನೇ ಕ್ಲಾಸ್. ಇಲ್ಲಿ ಶೋಭಾ ಮೇಡಮ್ ಇದ್ದಾರೆ, ಅವರು ನಿಮ್ಮ ಪ್ರಶ್ನೆಗೆ ಉತ್ತರ ಕೊಡ್ತಾರೆ.
ಮೇಡಮ್ ಶೋಭಾ ಮೇಡಮ್ನೇ ಅವರು ಕ್ಲಾಸ್ ತಗೋತಾರೆ.
ಓಕೆ.
ಸಮರ್ಥಮ್ಮ ನಮಸ್ತೆ. ಸಮರ್ಥಮ್ಮ, ಅವನದು ಪ್ರಾಬ್ಲಮ್ ಏನಂತ ಅಂದರೆ, ನಾವು ನಿಮಗೆ ಅವಾಗಲೇ ಹೇಳಿದ್ವಿ, ಅವ್ನಿಗೆ ಏನಂತಂದರೆ ಈಗ ನಾರ್ಮಲ್ ಸ್ಕೂಲಲ್ಲಿ ಇರುವಂತಹ ಸಿಲೆಬಸ್ ಅವನಿಗೆ ಕಲೀಲಿಕ್ಕೆ ಕಷ್ಟ ಆಗುತ್ತೆ. ಕೇಳಿಸ್ತಾ ಇದೆಯಾ ಸಮರ್ಥಮ್ಮ?
ಹಲೋ.
ಸಮರ್ಥಮ್ಮ ಕೇಳಿಸ್ತಾ ಇದೆಯಮ್ಮ? ಏನಂತಂದರೆ ನಾವು ನಿಮಗೆ ಪ್ರೀ ಸ್ಕೂಲಲ್ಲಿ ಬರುವಾಗಲೇ ನಾವು ಅವನಿಗೆ ಮತ್ತು CSS ತೊಗೊಳ್ಳುವಾಗಲೇ ಹೇಳಿದ್ವಿ, ಅವ್ನಿಗೆ ಏನಂತಂದರೆ ರೆಗ್ಯುಲರ್ ಕ್ಲಾಸ್ ರೂಮಲ್ಲಿ ಏನಿದೆ ಅವನಿಗೆ ಸಿಲೆಬಸ್ಸು ಅದು ಅವನಿಗೆ ಅರ್ಥ ಮಾಡಿಕೊಂಡು ಅದನ್ನು ಕಲಿಯೋಷ್ಟು ಸಾಮರ್ಥ್ಯ ಅವನಲ್ಲಿ ಕಡಿಮೆ ಇದೆ. ಸೊ ನಾವು ನಿಮಗೆ ಹೇಳಿದ್ವಿ ಫಂಕ್ಷನಲ್ ಲಿಟ್ರಸಿ ಬಗ್ಗೆ, ಅಂದರೆ ಕ್ರಿಯಾತ್ಮಕ ಒಂದು ಕಲಿಕೆ ಅವನಿಗೆ ಬೇಕು ಅಂತ ಹೇಳಿಬಿಟ್ಟು. ಅದರಲ್ಲಿ ಏನಂತಂದರೆ ಅವನ ದಿನನಿತ್ಯ ಬಳಕೆಗೆ ಬೇಕಾದಂತಹ ಓದು ಬರಹವನ್ನು ನೀವು ಕಲಿಸ್ಬೇಕು. ಅವನಿಗೆ ಫೋರ್ಸ್ ಮಾಡಿ ಅವನಿಗೆ ನಾರ್ಮಲ್ ಸ್ಕೂಲಲ್ಲೇ ಓದಿ ನಾರ್ಮಲ್ ಸ್ಕೂಲಲ್ಲಿ ಇರುವಂತಹ ಕರಿಕ್ಯುಲಮನ್ನೇ ನಾನು ಕಲಿಸ್ಬೇಕು ಅನ್ನೋಂಥ ಹಠ ಬೇಡ. ಯಾಕಂತಂದರೆ ಮಗುಗೆ ಓದು ಬರಹ ಏನು ಬರಬೇಕಿರೋದು ಅದು ಅವನ ಜೀವನಕ್ಕೆ ಬರಬೇಕಾದಂಥದ್ದು. ಅದರಿಂದ ಫಂಕ್ಷನಲ್ ಲಿಟ್ರಸಿ ಅಂತ ನಾವು ಏನು ಹೇಳ್ತೀವಿ ಅದ್ರ ಬಗ್ಗೆ ಜಾಸ್ತಿ ಗಮನ ಕೊಡಬೇಕಮ್ಮ.
ಆಯ್ತು ಮೇಡಮ್.
ಹಾಂ,
ಓಕೆ.
ನಿಮ್ಮ ಪ್ರಶ್ನೆಗೆ ಉತ್ತರ ಸಿಕ್ಕಿದೆ ಅಲ್ವಾ?
ಹೌದು.
ಧನ್ಯವಾದಮ್ಮ.
ನಮಸ್ತೆ.
So, Dr. Jayashree, can you please tell us as to what kind of professionals should we meet if LD is suspected in a child?
Yes, I think this is a very important question again, because there are a lot of parents who do something called as doctor shopping, mainly because not that they want to do it, but they are in so much of anxiety for the child that they go from one professional to another, and many times they actually don't know to whom they have to go. Okay, so let us just understand who are the team of professionals who are actually involved with children with learning disability. Primarily, I would say starting off with pediatrician, because I think the first thing that they do is they want to see their child doctor, as they say, the pediatrician. So once they go to the pediatrician understands that probably this child is not developing in terms of the literacy skills as other children do. They might suspect that, and the first thing that they do is they refer them to a psychologist. So it is important to go to a psychologist, and the psychologist actually checks for their intelligence quotient, intelligence basically. So we have to see whether this child is developing normally with respect to his intelligence. Okay, so what happens is everything, all the learning is dependent on their intellectual development, which means to say if the child has to speak, again it is dependent on his intelligence. If the child has to understand information, it is dependent on intelligence. If the child has to perform something, then it is dependent on your intelligence. So if you don't go to a psychologist, then you will definitely miss out on this information. Okay, and a lot of your training is dependent on how much the person has in terms of their intelligence quotient. Okay, so after pediatrician, I would definitely say psychologist will play a major role. This is the natural scenario that I'm talking about. Once the intelligence and all of that is assessed, you'll also see psychologists assessing for their behavioral issues or attention issues, as Mr. Shobha was mentioning, memory issues, or cognitive issues. These are the things that the psychologist will take care. Social issues also sometimes. So once that is done, it is possible that some of these children will get identified under some category to some extent. Then we also have some children with learning disability who can have probably problems in speaking. That means they have a very delayed speech language development, or you might often see that they are speaking very less, or they are speaking very differently compared to the other children. So you will have to seek the help of a speech language pathologist like us. So what happens with speech language pathologist assessing a child with learning disability is they will try to see whether their development of speech language is adequate to their age, or it is delayed, or it is deviant. Okay, so it is important for us to know that, because if we don't know that, a lot of times these children may not be understanding instructions properly in the classroom, and they may not be using their speech language skills orally, which in turn can also reflect on their writing skills. So they might write what they are speaking. If they are speaking wrongly, they will also write wrongly. So there are a large percentage of children, I would say, with learning disability who can have problems with speech and language. Then we also have audiologists chipping in. It is possible that if some of these children, they hear well, but they're not understanding the information that they heard. So which we call as auditory processing. So if they are not processing the information, then everything else after that, speaking or writing, everything will get affected. So parents will come and tell us that, this child is not doing well on dictation, which is highly dependent on how they're understanding through the auditory processing. So audiologists, definitely yes. And then we have special educators. Special educators have their set of strategies for these children whenever and however it is required, and a lot of times it is custom made. So they'll have to make curricular strategies for these children, and they'll start working on them. So that's how we also have Mrs. Shobha in our special clinic for learning disability at AIISH. Then we also have occupational therapist coming into play. It's possible that some of these children can have fine motor issues, because of which, their fingers, coordination with their fingers is affected, and they might find it difficult to actually write information. So the writing might be affected because of that. So many times the parents might be saying that, they're not writing legibly. Sometimes it might be very incoordinated. Sometimes you see mirror writing. A child writes P for Q or Q for P, or 9 for 6 or 6 for 9. Okay, so many people might have seen this in Tare Zameen Par movie. They can associate it very well. So occupational therapists work on these kind of sensory problems. Sensory problems can be visual. It can be because of hearing also. Motor sensitivity and is another important concept that occupational therapists will work. So I'll not go into the technical information of that, but what is important that we have to keep in mind is we definitely need the parents to go to a pediatrician, a psychologist, a speech language pathologist, an audiologist, a special educator, and an occupational therapist. So these team of professionals will come in for a basic assessment, but rehabilitation will depend on which type of disability the child has under learning disability.
Thank you, ma'am. So that should also lead to the question as to by what age learning disability can be identified. So Dr. Jayashree just explained as to how each professional would have their own role in identification and how they would go about the process of assessment. So when one needs to administer a series of standardized tests, it is easy to understand that a formal diagnosis of learning disability could be made by the age of 6 years or above. That is when the child has had sufficient exposure to formal reading and writing in the school environment. But it's equally important to remember that there are some early signs that one could look out for in identification of learning disability. So things like a delayed developmental milestones could be in the domain of gross motor, fine motor, or even the way they learn, the ability to grasp things in the early years of life. All these could be important signs to look out for. So we have a caller. Hello. Hello.
Hello.
Yes, ma'am.
Yes, ma'am. Good afternoon.
Good afternoon.
I have a child who is facing learning disability.
Okay, ma'am. Can you please tell us your name, please?
Ritvik Choradia.
Sorry?
Ritvik Choradia.
Ritvik Choradia. Okay.
Problem is that, ma'am, whatever he listens the words, in the same way he makes the spelling.
Okay.
Due to this spelling error, he is writing the paper and he is not having a good handwriting too. And whatever he is writing is not understandable to the teacher. But orally, if you will ask to him, he is able to answer.
Okay. Which class is Ritvik studying in, madam?
Class 7.
Class 7. Okay.
Yes, sir. So So what can be done so that his spelling errors could be removed? Like what could be done? What major steps should be taken?
Okay. Dr. Jayashree, would you first like to answer her, and then we will have inputs from the Mrs. Shobha also.
Yes, ma'am. Ritvik is your child's name, is it?
Yes, ma'am.
May I know your name?
Raki there.
Okay. Mrs. Raki, what I can understand with a few information that you have just given us is that probably this child could fall into somewhere auditory processing issue. So I was just mentioning, previously that audiologist usually takes care of these auditory processing issues. I'll just make you understand what is this auditory processing. A lot of times these children actually they can hear. So when you test them on audiometric testing, as we call, their decibels will be fine. They are normal hearing. Okay, but that information has to be going to the brain, and the brain has to understand that information. Okay, so it's possible that these children may not be understanding the information. They are hearing well, but they are not understanding the information that they are hearing. This is called as auditory processing. So what happens that time is they would have heard, but what word have they heard? To understand what word they have to, they have actually heard, they have to take help from the brain. So it's possible that he may not be processing at a higher level, because of which he is having problems in writing. So whatever he is hearing, since he is not understanding what he is hearing, he is writing it wrongly. Okay, so this could be a mere problem of auditory processing, but I would still suggest that before you get into these, I would say, technical jargon, please talk to a professional, especially a speech language pathologist and an audiologist. Find out from them, get it checked by them properly, and then ask them what has to be done with such children. Okay?
Ma'am, I have been taking therapy from your AIISH only. They have been said that there is a phonographic correspondence problem and a little bit of auditory processing.
Correct. Yes.
It is there.
Yes, they will work on that. It requires some days of training. Okay, once that train, so it's actually not a very big problem. Ideally, what I'm seeing from the situation, it's not a very big problem. It can be sorted, but you will have to get the child trained for that. Okay, once the child gets trained, you will see his PGC will improve. If his PGC improves, then his writing will automatically improve. Okay.
Ma'am, training we come every year for 15 days there only. We stay there and we have the TCPD classes also. But nowadays, due to very much they are busy, they are not providing the classes.
Correct.
So,
Correct. Yeah, I got your problem. I in fact head the TCPD department also, from where you're taking therapy.
Actually,
Okay.
my session was due from March, it seems, and they had been, they said that they will give, but they were saying that they will give only for once a week, and which was not sufficient for my child. As ma'am, if you consider it is a very, not very severe problem, but what I am facing is very big problem. Whatever my child knows, he can speak well, but when it comes for writing, he is not able to write his papers on and all. And for this, in the school also, his grades are getting lower, and I'm not very much worried about the grades, but comparison is being made between the children. So because of this, he is suffering from low confidence nowadays.
Okay. Can I speak now? Yeah. Mrs. Raki? Yes. See, we have a system in TCPD. I was just trying to tell you that coincidentally, I head that department. So I know the procedures there. So what we are doing is, we are giving therapy for 3 months. Okay. After 3 months, we have to give a break. And what is important that you need to understand is, whether you attend offline or online treatment, the parents have to work. Now, why we give break is, whatever has been taught, you have to work with the child. So our therapist assess whether you have actually worked with the child or not. Okay, and after that they will take a call on that. So if they have suggested you to go for 15 days therapy, it would be for that sake only. Okay, that is one thing. That
3 months classes previously I was provided.
Mrs. Rakhi, can I just interrupt you? What we can do is you get back to us, send in an email. My email ID is there on the website. Okay, we will send out your solution to this problem through the email. Okay, we can do that, because I can see that this is more a problem with scheduling your therapy sessions, isn't it? So we have some more.
One more problem I'm having, like school, I'm talking to the school people. They are not considering for oral papers or rather than multiple choice questions. So what can be done regarding that also?
For that, we'll have to contact your school authorities. Okay, you put in your complaint on the email. Okay, so based on that complaint, we will speak to the school authorities. Okay, fine?
Okay, ma'am.
Yeah. Fine. Mrs. Raki, do you have any more questions?
Ma'am, I wanted to know your name.
I'm Dr. Jayashree.
Okay, thank
Dr. Jayashree, TCPD HOD. You can go there and get my email ID from there. And please email me. Fine?
Yes,
Yeah.
ma'am.
Okay, Mrs. Raki.
Thank you, ma'am.
Thank you, Mrs. Raki. You can definitely get back and we'll assure that your problem will be sorted out at the earliest possible. Thank you.
Thank you.
So, in continuation with the same, Mrs. Shobha, can you please tell us as to what are the teaching strategies that can be adopted in a regular school to help children with learning disabilities?
Yeah, each child with learning disability is unique, and it learns it's in his own or her pace. So coming to the adaptation can be done in two levels. One is physical adaptation. As we all of us know that a child with learning disability distract very easily for the external stimuli. So it is important for the teacher to understand in what way the teacher can provide a barrier-free environment to the child in the classroom. And seating arrangement is also very important for the child with learning disability. And the second level of adaptation can be done in a curriculum adaptation. This is again can be done in three levels. One is the content adaptation, because child with learning disability may find it difficult to understand the regular curriculum. So using the maxims of teaching or principles of teaching, the teacher can simplify the content or the syllabus to the child so that the child can understand the concept easily. And a second level of adaptation can be done with the teaching learning materials. Teaching learning materials are the very good source of materials for learning. So, and the third level is evaluation. If the adaptation has to be done in evaluation also, the teacher has to use a custom made or tailor made test to understand the outcomes of learning outcomes of the child with learning disability. Coming to the strategies of teaching, there are n numbers of strategies. By understanding a child's needs and basic information, we can have different strategies. The first and foremost strategy is multisensory approach. Through our sensory organs, it is easily understand. Any concept can be easily understandable by the child. And the second one is peer tutoring. And the third one is a chunking method and mnemonic methods. And even through playway method also, the child can learn easily, understand the concept easily. And very important adaptation should be done in attitudinal adaptation, because without accepting the child, it is highly impossible for teacher to make any planning. So I request all the teachers to make a attitudinal adaptation first before doing any adaptation and strategies.
So, would regular school teachers be able to do it just by learning these, or would they need to have any special training or sort of
Yes,
thing?
yes. This is very good question. Collaboration teaching is very important. As Jayashree madam said, there are a multidisciplinary team is working towards the rehabilitation of child with the learning disability. So collaborative teaching is very important, and there are a lot of in-service trainings are available. Conducted by the state governments. Even AIISH is conducting so many in-services training programs for teachers with learning disability. Teachers with learning disability. So in collaboration with the special educators, speech language pathologists, psychologists, the regular class teachers can make a difference in
They
the...
can learn and
Yes.
adapt the same in their school.
Yes.
Thank you, ma'am. So, Dr. Yashoda, with so many issues around children with learning disability, is it possible that they have any psychological issues, behavior problems, or any sort of mental health issues?
Obviously, yes, because any individual, okay, per se, so don't accept that they have some difficulty. So it can be academics, or it can be maybe look or other things. So obviously, where our society is, we are majority of people, they demand that kind of grade or marks what a child is secured. So obviously, whenever child come across with any relatives or guests at home, obviously they ask, very first question is, what's your percentage, what's your marks? So that makes a child with disability, or especially learning disability, very insecure and very child lose his or her self esteem, thinking that okay, I'm not good at this, and I'm not able to do this, or the study is not my cup of tea, whatever it is. So with this, child gradually may develop emotional issues. Child may feel low, or feel depressed, or thinking that I can't achieve this, or I can't pursue my higher studies because I'm not good in the education. So all these things. So and they can't face even society or the our relatives just because their poor performance in academics. So this will obviously lead emotional disturbance in the child, kind of depression and other symptoms you can, or even panic or anxiety symptoms you can see. Along with this, there will be behavioral issues where a child may show some attention deficit issues, or a child may show some behavioral outcomes in the form of poor attention, they can't concentrate for a longer time on the curriculum or the teacher class. With that, child may distract other child. So in the classroom setup, what happens? What child and teacher is teaching over there, and a child may not be able to focus on that content. Obviously, child may distract other child who is sitting next to him or her. So that becomes a kind of conduct, and also conduct disorders and all. So like these behavioral issues also we can observe in the child with learning disability.
Thank you, sir. Dr. Jayashree, in your previous answer, you also mentioned that in addition to reading and writing, though they are the main problems, these children have additional difficulties with regard to their auditory processing, speech and language. So can you elaborate on the type of speech and language difficulties that these children could be facing?
Yes. So as I was mentioning that time itself, that it's possible that a large percentage of children, I would probably say around 70 to 80% of children who come under the term of learning disability have problems in speech language, which means to say they are called as language-based learning disability technically. So what happens in these children is, suppose...
Can I interrupt
yeah,
you,
sure.
please? Hello? Hello?
Hello? Hello?
Hello? Yes, ma'am. Please tell us your name.
ಫರ್ಹಾದ್ ಅಂತ ಕನ್ನಡ ಬರುತ್ತಲ್ಲ?
ಖಂಡಿತ ಹೇಳಿಮ್ಮ.
ಅದ ನನ್ನ ಮಗ 14 years ನಡೀತಿರೋದು 9th standard.
ಓಕೆ.
ಅವನಿಗೆ ಯಾವ್ದು ಇಂಗ್ಲಿಷ್, ಹಿಂದಿಲಿ, ಕನ್ನಡದಲ್ಲಿ ಇನ್ನೂ ಬೇಸಿಕ್, ಅವನಿಗೆ ಬೇಸಿಕ್ ಬರ್ತಾ ಇಲ್ಲ. ಅವನಿಗೆ ಎಷ್ಟು ಟ್ರೈ ಮಾಡಿದ್ರು ಇವಾಗ ಹಿಂಗೆ ತೋರ್ಸ್ಕೊಂಡು ಇದ್ ಮಾಡ್ಕೊಂಡು ಹೋದ್ರೆ ನೋಡ್ಕೊಂಡೆ ಓದಕ್ ಆಗಲ್ಲ. ಏನ್ ಹೇಳ್ತಾರದು ತಲೆ ಇಟ್ಕೊಂಡು ಓದೋದು, ಕೇಳಿ ಇದ್ ಮಾಡೋದು.
ಹಾ
ಹಂಗೆ ಬುಕ್ ಅಲ್ಲಿ ಇದ್ ಮಾಡಿ ಅವ್ನಿಗೆ ಓದಕ ಇದಾಗಲ್ಲ. ಆಮೇಲೆ ರೈಟಿಂಗು ಒಂದು ಇದಿಲ್ಲ. ಒಂದ್ಸತಿ ಅವ್ನಿಗೆ ಫಿಟ್ ಬಂದಿತ್ತು 7 years ಅಲ್ಲಿ ಒಂದ್ಸತಿ.
ಓಕೆ.
ಹಾ,
ಅದಕ್ಕೆ
ಅಲ್ಲಿ
ಔಷಧಿ ತಗೋತಾ ಇದ್ದಾನ?
ಆ
ಫಿಟ್ಸ್ಗೆ ಔಷಧಿಗಳನ್ನ ತಗೋತಾ ಇದ್ದಾನ?
ಅದು ಇವಾಗ ತಕೊಳ್ತಾ ಇಲ್ಲ. 3 years ತಕೊಂಡಿ. ಅವ್ರು ಹೇಳಿದ್ರು ಡಾಕ್ಟರ್ 3 years ಕಂಪಲ್ಸರಿ ಮಾಡ್ಬೇಕು ಅಂತ.
ಹಾ
ಅದ್ ಕೋರ್ಸ್ ಅದು ನಾನ್ ಪೂರ್ತಿ ಮಾಡ್ದೆ. ಅದು ಬಂದಾಗ ಅವ್ನಿಗೆ ಒಂಥರ ಹಠ, ಏನಾದ್ರೂ ಒಂದು ಇದ್ ಮಾಡ್ತಾ ಅದ್ ಬೇಕು ಅಂದ್ರೆ ಅದ್ ಬೇಕು ಅವ್ನಿಗೆ. ಅದ್ ತಲೆಯಲ್ಲಿ ಇಟ್ಕೊಳ್ತಾನೆ. ಏನಿದ್ರು ಅವ್ನ್ ಬರೀ ಅದೇ ದಿನ ಏನಾದ್ರು ಒಂದ್ ಬೇಕು ಅಂತ ಹೇಳ್ಬಿಟ್ರೆ ಅದು ಕೊಡ್ಸ್ಲೇಬೇಕು, ಇಲ್ಲಾಂದ್ರೆ ತಲೆಯಲ್ಲೇ ಇಟ್ಕೊಳ್ತಾನೆ. ಅದೇ ಬೇರೆ ಮಾತನ್ನ ಅವ್ನ್ ಹಂಗ್ ಮಾಡ್ತಾನೆ. ಕೋಪ ಬಂದ್ಬಿಟ್ರೆ ಇಷ್ಟೆಲ್ಲ ಹಿಂಗ್ ಹಿಡ್ಕೊಳ್ಳೋದು, ಕಣ್ಣಲ್ಲಿ ನೀರು ಹೋಗೋದು, ಯಾರು ಹಿಡಿದ್ರು ಅವ್ನಿಗೆ ಇದಾಗಲ್ಲ, ಅಷ್ಟು ಇದಾಗುತ್ತೆ ಅವ್ನಿಗೆ.
ಆಯ್ತು.
IQ ಏನೋ ಕಮ್ಮಿ ಐತೆ, 50% ಕಮ್ಮಿ ಐತೆ ಅಂತಾನು ಹೇಳಿದ್ರು
ಓಕೆ.
ಅವ್ನಿಗೆ.
ನಮ್ಮ ಜೊತೆ ಡಾಕ್ಟರ್ ಯಶೋಧರ್ ಅವರಿದ್ದಾರೆ, ಅವರು ನಿಮಗೆ ಉತ್ತರನ ನೀಡ್ತಾರೆ.
ನಮಸ್ಕಾರ ಅಮ್ಮ. ಆ, ಈಗ ನಿಮ್ಮ ಮಗು ತೊಂದರೆ ಗೊತ್ತಾಗಿದೆ. ಏನಂದರೆ ಮಗುಗೆ ಬುದ್ಧಿಶಕ್ತಿನಲ್ಲೇ ಸಮಸ್ಯೆ ಇದೆ. ಹಾಗಾಗಿ ಇದನ್ನ ಲರ್ನಿಂಗ್ ಡಿಸಬಿಲಿಟಿ ಅಂತ ಹೇಳೋಕ್ಕಾಗಲ್ಲ, ಆದರೆ ಬುದ್ಧಿ ಶಕ್ತಿನಲ್ಲಿ ಇರೋ ಕೊರತೆ, ಆಯಿತಾ? ಸೊ ಅದು ಒಂದು. ಸೊ ಅದು ಯಾವ ಕಾರಣಕ್ಕೆ ಬಂದಿದೆ ಅಂತ ಇವಾಗ ಮಾತಾಡೋದು ಬದಲಾಗಿ ಅಟ್ಲೀಸ್ಟ್ ಇವಾಗ ನೀವು ಒಂದು ಹೇಳಿದ್ರೆ ಇನ್ನೊಂದು, ಆ ಮಗುಗೆ ಫಿಟ್ಸ್ ಬರ್ತಾ ಇದೆ ಅಂತ ಹೇಳಿ.
ಅಲ್ಲ, ಫಸ್ಟ್ ಟೈಮ್ ಬಂದಿದ್ದಲ್ಲ, ಒಂದೇ ಸತಿ ಬಂದಿದ್ದು, ಪುನಃ ಬಂದಿಲ್ಲ.
ಮತ್ತೆ ಬಂದಿಲ್ಲ. ಹಾಗಾದ್ರೆ ಒಳ್ಳೇದಲ್ಲ. ಸೊ ಏನು ತೊಂದರೆ ಇಲ್ಲ. ಯಾಕಂದರೆ ಅದು ಪದೇ ಪದೇ ಬಂದರೆ ಅದು ಮೆದುಳಿಗೆ ಹಾನಿ ಉಂಟು ಮಾಡುತ್ತಿತ್ತು. ಬಟ್ ಅದು ಬಂದಿಲ್ಲ ಅಂದರೆ ಏನು ತೊಂದರೆ ಇಲ್ಲ. ಬಟ್ ಡಾಕ್ಟ್ರು ಹೇಳಿದ್ದಾರೆ ಅಂದರೆ ಮಾತ್ರೆ ಬೇಡ ಅಂತ ಖಂಡಿತ ನೀವು ಮಾತ್ರೆ ಕೊಡೋ ಅಗತ್ಯ ಇಲ್ಲ, ಒಂದು, ಆಯಿತಾ? ಸೊ ಈಗ ಮಗುಗೆ ವಯಸ್ಸು ಎಷ್ಟು ಹೇಳಿದ್ರಿ? 14 years. ಹಾಂ, ನನ್ನ ಪ್ರಕಾರ ಮಗುಗೆ ಒಂದು 6 ವರ್ಷ
ಇದ್ದಾನೆ. ಆದ್ರೆ ಇನ್ನೊಂದು ಚಿಕ್ಕ ಮಗು ಅಂದ್ರೆ ಇದ್ ಮಾಡೋದು
ಗೊತ್ತಾಯ್ತು. ಅದೇ ನನ್ನ ಪ್ರಕಾರ ನೀವು ಹೇಳೋ ಇನ್ಫಾರ್ಮೇಶನ್ ಪ್ರಕಾರ ಒಂದು 5ರಿಂದ 6 ವರ್ಷ ಬುದ್ಧಿ ಮಟ್ಟ ಇರಬೇಕು ಮಗುಗೆ. ಅಂದ್ರೆ ಮಗುಗೆ ಏನೋ ಬಣ್ಣಗಳ ಏನೋ ಕಾನ್ಸೆಪ್ಟ್ ಇರಲ್ಲ, ಮುಖ ತೊಳೆಯೋಕ್ಕೆ ಕಂಪ್ಲೀಟಾಗಿ ಬರಲ್ಲ, ಅಥವಾ ಸ್ನಾನ ಮಾಡಕ್ ಕಂಪ್ಲೀಟಾಗಿ ಬರ್ತಿರಲ್ಲ,
ಬರಲ್ಲ, ಊಟ ಮಾಡಕ್ ಬರಲ್ಲ, ಸರಿಯಾಗಿ ಚಪಾತಿ ಎಲ್ಲ ತಿನ್ಕೊಳ್ತಾನೆ, ರೈಸ್ ತಿನ್ನಕ್ ಬರಲ್ಲ.
ಈ ಮಗುಗೆ ನೀವು ಆದಷ್ಟು ಏನ್ ಮಾಡ್ಬೇಕಂದ್ರೆ ನಿಧಾನ ಸ್ಕಿಲ್ ಟ್ರೈನಿಂಗ್ ಅಂತ, ಅಂದ್ರೆ ಕೌಶಲ್ಯಗಳ ತರಬೇತಿ ಅಂತ ಹೇಳ್ತೀವಿ, ಅದನ್ನ ಮಾಡ್ಬೇಕಂದ್ರೆ ಪ್ರತಿಯೊಂದನ್ನು ನೀವು ಹೇಳ್ಕೊಟ್ಟು, ಮಾಡಲಿಂಗ್ ಅಂತ ಹೇಳ್ತೀವಿ, ಅಂದ್ರೆ ನೀವು ಮಾಡಿ ತೋರಿಸೋ ಮುಖಾಂತರ ಹೇಳ್ಕೊಟ್ಟು ಪ್ರತಿಯೊಂದನ್ನು ಕಲಿಸಿದ್ರೆ ಖಂಡಿತ ಕಲಿತಾನೆ. ನೀವು ಅದ್ರ ಬಗ್ಗೆ ಏನೋ ಗಾಬರಿ ಪಡೋ ಅಗತ್ಯ ಇಲ್ಲ. ಏನು ಕಲಿತಾನ ಇಲ್ವಾ, ಓದೋದ್ರ ಬಗ್ಗೆ ನಾನು ಹೇಳ್ತಿಲ್ಲ. ಅವ್ನ ಜೀವನ ಮಾಡಕ್ಕೆ ಏನು ಬೇಕೋ ಅದನ್ನ ಕಲೀಲಿಕ್ಕೆ ಖಂಡಿತ ಅವ್ನಿಗೆ ಆಗುತ್ತೆ. ಆದರೆ ನೀವು ಹೇಳ್ಕೊಡೋ ರೀತಿ ಮೇಲೆ ಹೋಗುತ್ತೆ. ಹಾಗೆ ವರ್ತನ ಸಮಸ್ಯೆ ಕೂಡ ಹೇಳಿದ್ರಿ ನೀವು, ಅದು ನೀವು ಮಗುನ ಹ್ಯಾಂಡ್ಲ್ ಮಾಡೋ ರೀತಿ ಮೇಲೆ ನಿಂತಿರುತ್ತೆ, ಅಂದರೆ ಮಗುನ ಹೇಗೆ ನೋಡ್ತೀರಾ ಅನ್ನೋದ್ರ ಮೇಲೆ ನಿಂತಿರುತ್ತೆ. ಅದನ್ನ ಸ್ವಲ್ಪ ಲಾಬ್ರೇಟಿವ್ ಆಗಿ ಹೆಚ್ಚಿಗೆ ಹೇಳಬೇಕಾಗುತ್ತೆ. ಬಟ್ ಇವಾಗ ಅದು ಸಾಧ್ಯ ಇಲ್ಲ. ಬೇಕಾದ್ರೆ ನೀವು ನಮ್ಮ ಸಂಸ್ಥೆಗೆ ಬಂದು ಡಿಪಾರ್ಟ್ಮೆಂಟಲ್ಲಿ ಬಂದರೆ, ಮನೋವಿಜ್ಞಾನ ವಿಭಾಗಕ್ಕೆ ಬಂದರೆ ಈ ವರ್ತನ ಸಮಸ್ಯೆ ಬೇಕಾದ್ರೆ ನಾನು ಟಿಪ್ಸ್ ಕೊಡ್ತೀನಿ. ನೀವು ಆಗ್ಬೋದಾ?
ಸರಿಮ್ಮ, ಹೇಳಿ ಏನೋ ಹೇಳ್ತಾ ಇದ್ರಿ.
ಅದೇ ಕೋಪ ಬಂದ್ಬಿಟ್ರೆ ಗೋಡೆಗೆಲ್ಲ ಇದ್ ಮಾಡೋದು, ಹೊಡೆಯೋದು ಕೈಯಿಂದ.
ಅದನ್ನ ನಾನು ಮಾತಾಡ್ತೀನಿ. ಬನ್ನಿ ಇಲ್ಲಿ ನೇರವಾಗಿ ಸ್ವಲ್ಪ ತರಬೇತಿ ತಗೊಂತೀನಿ. ಅದು ಆದ್ಮೇಲೆ ಬೇಕಾದ್ರೆ ನೀವು ನೋಡ್ಬೋದು.
ಸೊ ಅವ್ರು ಹೇಳ್ದಂಗೆ ನಮ್ಮ ಸಂಸ್ಥೆಗೆ ಬಂದು ಎಲ್ಲ ಅಸೆಸ್ಮೆಂಟ್ ಮಾಡಿಸಿ ಅದಕ್ಕೆ ಬೇಕಾಗಿರುವಂಥ ಪರಿಹಾರನ ನೀವು ಪಡ್ಕೊಳ್ಬೋದಮ್ಮ. ಥ್ಯಾಂಕ್ ಯು. So Dr. Jayashree, we were discussing about language-based learning disabilities, and you were telling about the speech and language issues that could be faced by children with learning disabilities.
Yes, so I was talking about something called as language-based learning disability. So very briefly to say this, just imagine that a child has to speak its first word, say appa, amma, by 1 year of age. That's the easiest timeline I can give you. And the child is not able to speak by 2 years or 3 years of age, sometimes 4 years of age. So this is called a delay. Okay, so children with language-based learning disability, it is possible that they have a delay in picking up these kind of skills. That is one thing. And another thing is every stage of life, they are supposed to pick up some amount of words. Okay, so you will see that a lot of times children with learning disability have a very limited vocabulary. That means they do not have as many words as a child of their age is supposed to have. That is another thing. Another thing that we observe is they might have picked up words, they might have picked up short sentences, phrases, I would say 2-word phrases, But if you see, by 3 years of age itself, a child is supposed to be using 3 words at least to form a sentence. So you might see that this kid who has come to you is around 10 years of age, but he's still answering to you only in a single word. He's not using phrases, he's not using sentences. So there again you can say that this child is having some problem with picking up his speech language skills. So these are different types of or stages of learning problems that you can actually detect and say whether this child with learning disability has problem with language. What happens with this is, suppose a child is probably not processing the information, the right amount of information at the right stage. You have already put him in school thinking he is normal to that age. So the child will not be able to understand instructions as all other children are understanding. If there are 40 children in the class, all the 39 children are following the instructions of the teacher, whereas one of this child is lagging behind. He's repeatedly asking questions, or he's not completing his work as per the instructions, or he's not reproducing, he's not even answering it orally, or he's not able to write it on his paper. So all of these kind of problems can also lead to academic difficulties. So it is better that you also get it checked from a speech language pathologist.
So that is to say that a detailed speech and language evaluation would also be a mandatory part of the assessment protocol.
Yes, very much.
Okay, thank you. Dr. Yashoda, can a child with learning disability avail any kind of benefit or concession in school?
Yes, of course. Because as you know, we know that it's disability and government providing many educational benefits for these population who are having issues in academics, especially learning disability. ಸೊ ಕಲಿಕಾ ನ್ಯೂನತೆ ಇರುವಂಥ ಮಕ್ಕಳಿಗೆ. ಸೊ ಅದರಲ್ಲಿ ಮೊದಲನೇದಾಗಿ ಹೇಳಬೇಕಾದ್ರೆ ಒಂದು ಲ್ಯಾಂಗ್ವೇಜ್ ಎಕ್ಸಿಬಿಷನ್. ಸೊ ದ ವೆರಿ ಫಸ್ಟ್ ಇಸ್ ದ ಲ್ಯಾಂಗ್ವೇಜ್ ಎಕ್ಸಿಬಿಷನ್. So where a child can get exempted by one or two language, or second or third language. That is one thing. And another one is the major maybe in mathematical difficulty child is having. So child can replace that mathematics with something else, maybe arts or home science or computer science and all. So such provisions are already given by boards, different boards, CBSE or NIOS or even state boards also. So other than this, there is another provision that where a child can have scribe. So where child, instead of child, somebody else can write the exam for a child. Where child perform orally, so child say oral answers, and where the other person writes child's answer.
So that is generally a younger
yes,
age.
That is one rule is child that the scribe should be one grade lower to the child's actual grade. If child is 10th standard, then the scribe should be at the 9th and below to that standard. That is one thing. And other than this, even extra time is allotted. So every 1 hour exam, so there will be 20 minutes of extra additional time will be given to the this population. So like these, so many provisions are given. So and a calculator facility, so or some other sometimes the computer will be provided without internet. So these are the provisions already government is provided, and of course they can use these facilities and they can have the basic education. There is no doubt in that. So all the parents who are with this kind of children, they can relax and they can definitely you can reach your child to get or secure some basic education. After that, you work on the skill development. So that is what I can see.
Okay, so to avail these benefits and concessions, they should first have a disability certificate.
Yes, of course. As already we discussed, it's a multidisciplinary approach. So they have to visit multiple professionals or multidisciplinary. Like our institute, we have like speech language pathology, audiology, psychology, special education, and all. So and all this professional's opinion is needed before diagnosing. After that, if child is eligible, so then child will be issued the certificate, and that can be placed in the board, and from there they can get a UDID card, and through that they can approach all these facilities.
Okay, thank you so much, Dr. Yashoda. So now that we are reaching the end of the program, I would like to request Mrs. Shobha to give her concluding remarks and some tips to teachers and parents regarding this issue.
My humble request to parents is that please accept the child's disability. And as Madam Lee rightly said, critical age is very important. So I stress on early intervention of the child with learning disability, which is more useful for the child to be mainstreamed in a regular school at the right age. And my sincere request to teacher is that please accept the child in a regular classroom, and with some small modifications and by using strategies in teaching, the child can cope up in a regular classroom.
Uh, Dr. Jayashree, can we have your take-home message?
Yes, from my side, this is my experience of seeing some of these kids in our special clinic. I would like all the parents to know that don't have over expectations because these children have problems. That is the first thing that you have to understand. You have to accept the problem, because after that you can think about the solutions. There are definitely umpteen number of solutions. Professionals will definitely lead you to those solutions. Every child need not become a doctor. Every child need not become an engineer. There are lot of other courses that are available. There are skilled based courses that are available. There are vocational training centers that are available for children with learning disability. You just need to contact the right professionals. Like for example, in AIISH we have professionals who can help you to reach out, for such training institutes. So please do not lose hope just because your child has been labeled with learning disability.
I think in the same line, maybe you could add on a note about whether, if identified early and rehabilitated effectively, can a child outgrow learning disability?
I would definitely not call it as outgrow learning disability. I think we are only going to help him cope up and give him some management strategies. So if it is something that the parents are looking out as a cure or treatment, no, we would not say that there is a cure for learning disability. But the child can definitely cope up with appropriate remediation or management strategies. Yes.
Thank you, ma'am. Dr. Yashoda, can we have
Yeah.
your concluding remarks?
The term learning disability, it's majorly related to academic field. So when it means that child can learn even other things. So it's not that child cannot learn anything. So child may be good, may become good, sports person or musician or something else. So if you focus only on academics, then definitely you will not find the meaningful outcome from child. So for that reason, I always suggest the parent that with this kind of such kind of children, that please focus on the strength of a child, not the weakness. So just consider that okay, weakness of this child is academic area. So forgetting that or just ignoring that, focus on the other area so that you can strengthen that child's personality, and even child can contribute, or child can perform better in the life. So it's not just in end of the life when child is not studying or not getting a good marks. So it's ultimately child should able to succeed in his own or her own field. So that's what always matters. Please take care of this thing.
Okay, thank you. So I think with all these information, it's more important to realize that learning disability can affect a child beyond academics and can also impact their relationship with family, friends, and also in their workplace where they grow up and take up some work. And not every child who do not perform very well in the academic need to be termed as lazy or not putting in sufficient efforts, and everybody should look beyond academics is just a part of the life and not entirely everything about it, right? So they could genuinely have a problem that needs to be shown. Consult the right professional, take their inputs, do all that is required to help the child in every possible way so that they can also achieve success in their life. So you can log into our website www.aishmysore.in for more information and details. And as I mentioned, the program is being streamed live on Facebook. It will also be recorded, and the recorded version will also be available on the Institute official Facebook page. You can view it at your convenience, and if you have more queries or questions, the same can be posted in the comment section. Our resource persons will be more than happy to answer that and help you in every possible way. And if you cannot reach us in person, the institute also has a Tele-Center for persons with communication disorders, where tele-assessment and tele-rehabilitation services are also provided. The information can again be obtained from the website. You can reach us at any time and avail all the services possible. So thank you to all our resource persons, and thank you to
so
all our
much.
viewers.